It's my feel-good breakfast show.
It's a Tuesday morning and we welcome you back to your Feel Good Breakfast show. Thanks so much for joining us. Now, although we're not able to completely predict or cure every disease and ailment, there are a multitude of things that we can all do every single day to ensure that we give ourselves the best chance of staying healthy. Our diet is one of the key factors in the battle against diseases of various types. And to delve deeper into the topic and share her health knowledge with us this Breast Cancer Awareness Month, we've got Megan Pence-Clates. Welcome back to the show. Great to have you here with us during such an important time when we are trying to spread as much information as possible and knowledge regarding cancer in its entirety and just how we can better take care of yourself, right?
Yes.
Now, they do say that prevention is better than cure, and we're looking to, of course, infuse that into our daily lives. We've talked earlier on about screenings with Dr. Apfelstedt as well. Let's talk about how we can give ourselves the best fighting possible chance against breast cancer.
Absolutely. So the first way to do that and to start is looking at a healthy, balanced diet. And what I would like to say is I'd like to challenge everyone to make at least 2/3 of your plate plant-based. So you're looking at your fruits and your vegetables, your seeds and your nuts and your legumes.
Yes.
And then, of course, adding into that regular physical activity. And by that we mean at least 30 minutes per day. 5 days a week. That's the World Health Organization guidelines. And then to help maintain body weight. These are all factors that have been shown to help reduce your risk for cancer.
Yeah. And of course, when you look around online, there's always some headline that says the latest superfood trend is this, eat this, don't eat that. Let's try and narrow down that list into the groups of foods that we should include, and I think you named a few of them early on as well, that we should definitely include and those that we should definitely try to avoid.
Absolutely. So the first I would lump together a little bit is firstly your plant-based, particularly, so your fruit and your vegetables in particular, and then you've got your legumes and your starchy foods. And what they really offer you are loads of phytonutrients, and they've got antioxidants, as has your good fats, your, so things like canola oil, olive oil. And what they really also add is, particularly your canola oil, is omega-3. And that's an essential fatty acid that we have. So those are really nutrients that we need to concentrate on increasing in our diet, and they help to reduce risk.
Yeah. Where do we find these omega-3 nutrients? I mean, fish is one of the ways in which we can find it, right? We know that some nuts as well contain omega oils.
Yes.
Any other alternatives that you could suggest?
Absolutely. So if people can't, don't have oily fish, or they can't find oily fish, then I would recommend looking at something like canola oil. We've got our canola and olive blend, which is great for cooking. And what's also really nice about it is it has less than 8% saturated fat. It also is cholesterol-free. And it is something that you include in your diet because it's high in omega-3.
Yeah.
So that's really the route you'd like to take.
Yeah, excellent. And then also, we spoke to the doctor earlier on about having regular checkups. And I mean, sometimes people avoid doing those regular checkups because of the fear of the unknown. You don't know what the procedure is going to be like. Maybe you're afraid of the results that you might get. There's busy schedules and life just kind of getting in the way. But ultimately, would you say that getting those regular checkups is well worth the effort at the end of the day?
Absolutely. So it's many of us are fearful, which is understandable. But and we also don't find time. We also believe it's very costly. But the times, if we actually go for regular screenings, what we do find is that they might actually help to identify if there is a concern and a problem, or if we actually are doing something to increase our risk, which then immediately allows us to help reduce our risk. And what we're also doing with BWELL is, because it's Cancer Month, is at the Tygerberg Hospital, we have the oncology ward for the children.
Yes.
And we were able to go and give out care packs to the children and to the nurses that contain things like BWELL products, as well as your children's activities, because it's Cancer Month.
Yes. And then also speaking about BWELL and what the Cancer Association are doing, there is a free resource online that could help you kind of work your way through the culinary side of things, especially when you are looking at including all those wonderful food groups that you referred to earlier on. Where do we get the Smart Choice Cookbook and make it a part of our households every day?
Great. So you just go onto the www.bewell.co.za cancercombat.co.za, and you can look under your recipe books and you can download it for free. So it's the Cancer Smart Choice recipe book, and it does also contain our products that contain the Cancer Smart Choice seal, which is then be assessed by cancer.
Excellent. All right, fantastic. Because I was about to ask that question, that when a product does have that seal, what does it signify?
Okay, so in terms of what we've done at Cancer is we've analysed the product in terms of any type of benefit it might have to help reduce the risk for cancer.
Excellent. Well, it's always such a pleasure to have you with us, Megan. Fantastic. Thank you.
Thank you.
Well, of course, a massive thank you to Megan for taking the time out to talk to us and, of course, show us how easily we can all make a difference, and, of course, to BWELL and their range of cancer-approved recipes. And speaking of which, let's hop on over to the kitchen to make some delicious choice fruity oats.